Forward with this recording so we can share it with folks who aren't able to join us. And I am going to turn it over to our colleagues from University of Connecticut Innovation Institute, who are going to talk to a little bit more about the system reform support instrument, the SRSI assessment work they've been doing with many of our local system of care partners and the System of Care Advisory Council. We're going to hear a little bit more about kind of what they learned as they worked their way across the state, meeting many of you and our local system partners, and kind of their observations and their recommendations for how we can continue to improve Oregon system of care. So with that, I'll turn it over to you, Con. I don't know who's going first.
All right, thanks, Christy. Thank you so much all for welcoming us into your space today. My name's Johanna, pronouns are she, her. I'm a program manager with the Innovations Institute at University of Connecticut. I'm seeing many familiar faces and names and some new folks. So we'll do just a quick introduction from our team, and then I've got some slides and visuals and a story to share with you all. I would invite just from the beginning that we would really welcome this to be dynamic and to hear your questions and your ideas. So as presenters, we're really comfortable with you, raising your hand or popping to the chat with us questions as we go. And I'll be mindful to pause intentionally to offer time for us all to happen. For me, in sort of the life cycle of our work with Oregon, today feels like a time where we can take what's been sort of individual strands of work and bring it to a place where we can start to coordinate and align. That feels really important, like an important timepiece for me. And so making sure folks feel like they have a strong understanding of how to engage moving forward feels like a good goal for today. So you're going to hear my voice quite a bit this evening, but I'd love for you all to hear from Denise and Kim. Denise, can I pass to you to say hello?
You sure can. Thank you. Denise Sulzbach, pronouns she, her. I am, my role at the Innovations Institute is I'm the director of the TA Network, which is really our system of care consulting arm. I think Kim and I joined you last July, I want to say. It was in the summer when we first started launching this system reform support instrument work. So thanks for having us back. While Johanna and Liz have been working with the local system of care councils, Kim and I have spent a lot of our time working with the SOCAC. So thanks for having us. I have 2 rescue dogs. I have a power washer outside. They're not happy about it. So I'm going to stay on mute most of the time, but I may pop in and out. So thanks again for having us. Kim?
Hi, and I'm Kim Estep, also at Innovations Institute with my lovely colleagues who just talked. And I'm the director for system design and implementation strategies at Innovations. And we are excited. I can't believe it's been almost a year, Denise. Like that was a flashback. And it's been great. So I'm really excited actually to hear about the work that's going on at the locals, because Denise and I have not been part of all of that. So excited to be here.
Awesome. Okay, grateful to have Kim and Denise here to support and just flag anything in the chat if I'm missing it as we move along. So welcoming all, I was just gonna, I'll pull up some slides here and then just start with a quick refresher of like, what have we been doing in Oregon over the last 9 months so we understand how we got to where we are. But let's make share screen happen for you all here. Okay. All right, so this is us. Our goal here is to share a little bit about the work that we've been doing, particularly if some of you have been engaging with us in one piece of the work, you might want to know what's going on sort of in the next room. We have some quick data to share with you. For those of you that have engaged in a system reform support instrument or the SRSI tool with us, you are you've seen your own data results and worked with us on that. We'll share them collectively in one way today to give you a taste of sort of alignment, what else is happening, and go from there. The SOCAC specifically has moved forward in their process using their SRSI results to identify a set of priorities where to focus their time and attention over the coming months. We're going to share those with you all so you have an understanding of the direction we're heading. We'll discuss how the priorities connect to the system of care strategic plan, and particularly the voices of family and youth, and what they've already shared with you as sort of their call to action and advocacy work for system of care moving forward. You'll hear from us that one of the pieces of work we're picking up is care pathway analysis. So just a minute there so we can make sure we're on the same page. And then I'll share a little bit about what sort of resource and time we have to work with local systems of care through today to the end of June. And we're gonna, again, questions and discussion throughout. At the end, we really want to make sure that we have a pretty robust discussion on alignment and what we can do and what we sort of need from each other, resources that might need to be identified in order to tie action planning that makes sense for local systems of care and the SOCAC moving forward. So roadmap for our time together this afternoon. We've alluded to the fact that we sort of have a team of folks supporting technical assistance and coaching work here in Oregon. So about 9 months ago, you all met Kim and Denise here in this space, introducing our work at the Innovations Institute and a particular instrument, the SRSI, that we like to use with states when you're really trying, when your question is, right, how do we make a more effective system of care governance structure? And so that began a journey of work with us. Kim and Denise have continued to support and liaison with the SOCAC advisory board, SOCAC staff to implement the SRSI tool. Their results and findings came back. There's been a discussion and then a prioritization of what we think about as action planning. So it's great to use a tool to learn more about the realities of your system, but we really care about what do you do about it? How do we make things better for children, youth, and family in our state? So the SOCAC has firmly moved into action planning. About 6 months ago, my colleague Liz Manley and myself offered the opportunity for any of the 14 local system of care structures and any tribal system of care structures that were interested to align and participate in a parallel process. So we've met and engaged in TA with 11 of the 14 system of care. So that sort of appetite and interest to talk to us was more impressive and robust than we had even dared to hope for. So just thank you for those of you that have given time and space of your own and also of your system of care members to engage with us. And from there, 8 local systems of care completed the system reform support instrument, the SRSI, completely received their data and have started to engage with us in prioritization discussions. So what does this data mean to us? So I'm going to be talking primarily about the data from the SOCAC SRSI and the 8 local systems of care who participated. I would propose or ask you to engage in a consideration that even if you're from a system of care community or region that didn't engage in the SRSI, that there are likely findings here that may be of benefit for you. And we also are really excited to engage with you in this next step, right? Like your input and discussion matters. And I think you'll find some ways to map onto that. And then the last piece I just wanted to add, because some of you all have been in meetings about this, we have another set of teammates at University of Connecticut who have been engaged in an analysis of the Medicaid financing landscape in Oregon and have put forward a report of their findings. And we have made sure to interlace and learn from their findings and include them in our recommendations and everything I'm sharing with you all. But that report and those findings may be of interest to you as well, sort of above and beyond our discussion today. So just uplifting that because we feel like we've got a lot of players engaging with you in a lot of ways. One thing that emerged is in our discussions with local systems of care is this question of what is the SOCAC going to prioritize, and does it matter or affect what we might want to put into our action planning? And that question got us to today's meeting. Like, let's put what we know out in front of everybody so we have shared knowledge and can move forward. So that's where we're going today. So first I'm going to jump into sharing the overview of the findings from the SRSI. For those of you that have had data presentations in your local systems of care, you know that there's just a lot in the SRSI. So again, pretty high level summary for you all today. If you have more questions, I'd love to dig for answers or find more detail for you. So please get curious. As a quick refresher, the SRSI, we are scoring the pre-implementation phase. There are 40 indicators, and these are core actions with defined scopes or definitions that we know to be part of robust, effective children's systems. We looked at the 40 indicators are measured across 4 domains, and I want to share them with you today because it's how I'm going to share the data. So we look at what are the actions your system of care are doing at the policy leadership level, at the management level, at your practice service delivery level, and then within your community. And active, robust systems of care are doing work in all of these areas that look a little bit different. And so the instrument looks at different indicators within each of these domains. Okay, so you're going to hear me say this policy, practice, community stuff a lot, right? Okay. So here's our first quick look at data. And so what I would invite you to look at is the top left-hand corner. If we were to look at all 40 indicators, and if a system was operating sort of at full blast, full implementation of all 40 indicators, that would be sort of 100% implementation. I also often ask you all to take a deep breath when we talk about these numbers. No system, even systems that are working better than we might envision our current system, are working at 100%, right? This is a world, systemic work is a world where there is always opportunity for quality improvement, right? But so this top left-hand corner is your overall summary of all of the indicators. The green number is, and all of these slides, is going to be the aggregate of all 8 local system of care regional results. And the yellow is going to be the state SOPAC results. And so what we see overall, right, is that we're at a 15 to 20% implementation of all of the things we could be doing to operate effectively. This has felt a couple of ways. It's felt heavy sometimes when we talk about this in communities, like, oh, that means there's a lot of things we need to be doing. It has also felt like opportunity. Oh, we just did a really deep self-reflection practice of what we're doing that's working and what's not. Now we understand what we could put into practice in order to be a more effective system of care. So it's also felt a little eye-opening, like, oh, I know where we need to go. I invite you to hold both of those realities. I would also invite throughout these next sort of 3 slides, encourage you to see the alignment and the similarity in scores between the SOPAC and the local systems of care. Because one of the stories that's emerging that feels important to me as I help you all think about action planning is that there is this similarity in where we are. We're doing work in similar areas. And to me, that gives us the opportunity to think about, ooh, if we all prioritized a few of the similar indicators to implement, we could see some really big shifts moving forward. Okay, so the totals here, again, are just the total implementation result amount of all 40 indicators. The other 4 graphs here are showing you the totals of implementation at the policy, management, practice, and community levels. So again, where the SRSI breaks the indicators down. What I would encourage you to think about and remember, and for those of you that have looked at local data and not the state data, you're going to remember me saying this. There's a lot of implementation work in Oregon focused at the policy and the community level when we think about system of care, and a little bit less in management and especially in practice. And so we've talked, and I think we should continue talking about why that is so and where you want to prioritize your effort. think about this slide as sort of table of contents for what we're talking about today. We're going to go a little bit deeper into each of these 4 sections. So if we talk about what are the indicator results showing us within the policy subsections, within the policy indicators, we measured things about leadership, accountability, financing, and access. And so here you see implementation progress in these 4 categories. So when we think about policy, so again, sort of, I think about your governance level, your highest level executive decision-making structure within your system of care. We see the most indicators moving forward in this leadership level. Thinking about how do we build strong cross-system collaborative tables with youth and family lived expertise, meaningfully engaged. Do we have a plan do we understand our care pathway? Do we have a plan for mobile response services? Do we understand and offer a service array that meets the urgency and need of families? Those indicators were at 25% implementation level and where we see most of the work. Some progress in implementing and financing, some around accountability. That will probably come up in our discussion a little bit later, and then less work around access and appropriate populations. There's only a couple of indicators that we measure in policy for this, and so if you're not doing this work yet, right, you're seeing those numbers reflected as not being implemented. The second level that the SRSI looks at is at the management level. So sometimes this mapped, you're all structured a little bit different, right? But sometimes this mapped well to your advisory committee structure, if you are not working within that sort of combined committee structure. But thinking about cross-agency partnership within your system of care and how is implementation of effective system of care practices going in this space. So again, these indicators looked at leadership, financing, accountability, and access and appropriate populations. And we see some more variation here in implementation scores, right? So I start to get really curious and want to go, ooh, can I dig back into the SOCAC results and think about what practices do they have around financing practices here that maybe haven't been replicated or brought into local systems of care practice? What might we be able to learn or share there? And again, we see implementation practices of the accountability indicators here pretty low. So there's a lot of curiosity here, and I'll show you where that sort of peaked in what we heard out of priorities from the SOCAC as well. The third level that we look at in the SRSI is that practice level. So really thinking about providing that care and services and supports to children, youth, and family. 3 subsections here. So workforce, accountability, and then what is that services and supports. We're seeing pretty low levels of implementation here. Couple of stories emerging for you all about that that I think makes sense. One overarching theme that comes up particularly in discussion at the local level is just there's been a long history of system of care implementation in Oregon, and our shared understanding of what making a system of care into has evolved. Like we've had we're on a life cycle of system of care implementation, and there seems to be sort of in the last 3 or 4 years an evolution of a more robust definition of a system of care, and with that evolution has changed some of the ways that we practice and structure a system of care. And so some of those changes might have drawn us towards the policy leadership implementation work and away from sort of system of care being implemented at the practice level. We're here to be curious with you all and think about how we can grab hold some of these practices and bring them back to life. The 4th level is community. I don't want to forget it. There are only 3 indicators that we measure around community in the pre-implementation phase. So that first slide you saw with a summary of about 50% implementation, that's true. There's no more further detail or subsection there. And what we see sort of universally across is that everybody's doing something about being transparent of sharing system of care, reform goals, progress in making change, transparency in ways for your youth and families to become engaged in your practices. We all are doing some of it, and we'd all like to be doing a little bit more of it. So a lot of good work there and things that will keep growing on. For those of you that have seen some SRSI data results before, I'm hoping, and definitely share in the chat if this isn't true, like I'm hoping you're feeling some similarity of like, ooh, yeah, we've all got a lot to do and we're all like on similar routes and pages. We can do a lot more with this data. So, we have all of the 8 local systems of care that participated in SRSI have their own individual unique data. We have it too, so we can do some comparisons and matching up of peer learning of like who's implementing something that others would like to learn from. Didn't want to share everything today, but know that we can dig deeper if you all have questions. So I'll pause here to see if anyone has questions about either the implementation of the SRSI findings as they're presented today, or where you'd like to learn more. Yeah, pausing there before we talk about what are we going to do with these results, or what is sort of already happening. Okay. Especially for sort of like my system of care coordinator friends who have engaged in planning calls with me. One thing that I would just put on your radar to think about asking us if it would be helpful, when you all got your SRSI data back, we were using sort of that estimated aggregate of local SOC results that was prepared sort of the tail end of 2023. The data today is complete with all scores in. So if it would be helpful to have updates to those comparisons, that's something we could build into any future meetings we have as we talk about action planning. And if it would be interesting or helpful to have the state SOCAC data compared next to your specific community, that's also something that's pretty easy to put into our future planning. Okay. So our team really wants to help you put action into place and to do things, right? We know that system change takes a long time, and one of sort of the practices that helps keep our change partners and our collaborators at the table doing the hard work is to see some good stuff happen. So our goal is to help you see some good stuff happen as well. So after data collection happened, which you all know took a long time, we've really pivoted into what comes next. So the next ask for us was really to work alongside the statewide System of Care Advisory Council, the SOCAC, to say, okay, we have SRSI results, so what do we do? And so our team reviewed all of the results, taking into account the local System of Care SRSI results, and then took alongside that process, reviewed and crosswalked many other documents that were uplifted to us in our TA as important to you all. So we started with the youth and family voices, and particularly paid attention to the coordination of what youth and families were asking that were a part of the statewide strategic plan. And then in addition, we looked at everything that's on this slide plus some things and try to, sort of take a step back and look for a couple of things. Look for synergy. Where in all of your planning, in your surveying of your work, in the sort of reports, whether it was the finance analysis our team was doing, or like I spent a lot of time reading the behavioral health report that came out of the Ombudsman's office. When we looked at all of those, what were the critical sort of calls to action or needs that were repeated over and over again, So where were we already hearing you all say, this is what we want to see change? And then the second thing, looking at where could something happen, implementation of a deeper system of care practice go into place that could then sort of create a domino effect where other good practices wouldn't come more easily afterwards. And we did this crosswalk in order to create a presentation to offer to the SOCAC of if we were you, what would we spend our time doing? And so that set of recommendations was brought forward to SOCAC, and then there was discussion of we can't do everything, right? And so what might be reasonable in the time that we're on contract to help work with you, you know, if we think of the next 3 to 6 months, what would be feasible to take on? So out of that conversation, I'll share a little bit about where we landed. Everything here again was designed to take to the SOCAC to think about as a statewide level. So for those of you that are operating in and with a specific region, a local system of care, these aren't necessarily the recommendations that were developed for you, and yet we feel like there will be some synergy where you might want to tap into them. So this slide of the too many words that are too small, I know, don't read it, it's okay. Here. These are all of the recommendations that we presented to SOCAC of things that we would bring to their attention to consider. The boxes that are in color, so are bold and bright, are the strategies that were affirmed and voted by the SOCAC to move forward. So those 5 blocks are what we're going to focus our time on in developing action plans with them. Thank you, Kim and Denise, for leading that work. They are organized by the pillar of strategic plans. So the strategic plan that's guiding the SOCAC overall has 4 pillars. You see that they picked an action strategy or 2 that aligns with each of those pillars. And I think that makes a lot of sense. So we'll talk about more of those in brief on the coming slides. Okay, so the way this is organized, the middle big lettering in the hot pink red color is the strategy that was prioritized in the SOCAC. The left-hand dark color is the system of care strategic plan pillar that it is attached to. And then what I'm really excited about is the blue on the top and bottom. Those are the SRSI indicators that we match to the action. So if this action moves forward, these are the indicators we'll use to progress monitor success, and the result of the action is going to be increasing the robustness and effectiveness of the implementation of these SRSI indicators. So for those of you that were like, oh my gosh, 40 indicators, that's so much to do. This is an example of saying, we're going to do 4 or 5 things, and they're going to touch these specific indicators. So bringing this into the realm of, reasonable actionableness. So one of the things we're going to do is working on establishing system of care governance structures that have clarity in their role as oversight and accountability bodies at the local and state levels. So how do we really move from feeling like advisors to the system to leadership within the system? And this came up as sort of a priority area in many of the different documents we reviewed and in the SRSI results. And particularly, we'd be digging into the indicators that are talking about, are we bringing all of this child serving systems to the system of care table with family and youth with lived experience, right? So are all the right people who are necessary to operate a system of care at your table? And are they doing the work of governance of system change and reform? And then the second is this mechanism for family and youth partnership at all levels. So is lived experience guiding and a part of our decision-making process at our policy management and service level. So that's priority area number 1. The next 2 action items that are prioritized from the SOCAC are around data-driven decision-making. So we spend a lot of time and effort in Oregon cultivating input, looking at qualitative and quantitative data of what's happening in our system. The question that really keeps coming up is, do we use all of the information we have to make more effective decisions? And so figuring out how to be a little more effective there. And then, yeah, there's a lot in both of these indicators, right? That I keep saying, like, we need to build our muscles around data-driven decision-making. And a lot of discussion, sometimes it's tension, sometimes it's just sort of desire to do more with what we have. This idea that we know different things at the local and state level, and can we get better at the bidirectional feedback between our layers within the systems, again, to make better decisions. So around these two actions, there are 3 indicators that are again in the blue teal on this slide. So do we have established ways to collect data in a way that allows us to share it in a meaningful way? There's a lot of interest in getting better at this. Do we have feedback mechanisms for state and local implementation teams to talk to each other and also to monitor progress around your change goals from your data? So every time we come back to the question of, do we know what data we should even be looking for in order to know if we're being successful? Like, I love that question. We want to spend some time figuring out the answer to that. And then the third indicator that we're looking at is, do state and local implementation teams that include all of the right players at the table know how to sort of coordinate and operate with each other? So more to come on this. Pausing here really quickly, just to show how we were thinking about alignment and really double checking ourselves about these recommendations. So everything on the bottom half of this slide comes directly from the Voices of Youth and Family as we read them and came to understand them in the System of Care Strategic Plan appendices. And so when we looked at these 3 action steps, thinking about governance structures that work with clarity, that we make data-driven decisions, and we have the capacity to use the data that we have in front of us, we heard, like, y'all have already been told and asked to prioritize this work, and we're finding the same things through the SRSI process. So I think this gives me a lot of excitement, right? Because I think there will be drive and passion and interest within our system of care structures to do the work that was prioritized. 2 more action strategies came out of the SOCAC's work here. The next is to conduct a care pathway data analysis. Kim is going to talk a little bit more about what this is actually going to look like in Oregon, but I'm here to share that the SOCAC has said, yes, go forth. This is sort of the next step that we need. And so our team is in progress to help with this data analysis. And really what we're looking for, what we'll monitor in the SRSI indicators here is, do we have a common vision and goal for system reform? And then do we have the leadership in place in order to move forward the resources and to make the decisions for us to reach that reform? We've talked sort of back and forth at different times with you around the value of understanding what your care pathway looks like and why understanding that might help you make more positive change. So this is us saying, oh, we got asked to do it. We're gonna do that work. More about that in just a minute. The last priority action step that came out of SOCAC is to address disparities identified through that care pathway analysis. And this will be connected back to that idea of how do we do data-driven decision-making. So if we understand who our care pathway is working for and who it's not, we can ask ourselves why, and then what do we do about it? And so excited about this. Connecting to indicators here around this idea of caregiver sense of urgency. So if a youth or a family is showing up, asking our system for help, are we responding to their need at that urgency and time that they're asking for it? And is it the right amount of support for what they need? So those are indicators that will match forward to these action steps. These last two strategies, again, same check for us. Does this align with what we hear from lived experience advocates in the state? And yes, we're really hearing a very clear request for coordination of cross-system supports to be available when youth and family need them, right? And so again, sort of valuing the potential sort of activation we can have around, really the sense that moving any of these 5 priorities that came out of our work and the SRSI work with SOCAC are going to also feed in and create value and action in what y'all were already challenging yourself to do within your strategic plan. So maybe a more narrow critical action step than do better, make big change. We'll work in these core 5 areas. So what happens next is action planning. I'm going to talk a little bit more about that from how that's going to feel at the local system of care lens, because that feels most practical for you all on the phone today. But to bridge the actions of what the SOCAC is going to be doing and what the locals are going to be doing, we think it makes sense to just make sure that we're all in alignment and understanding what does the care pathway analysis work look like, because that is going to take a chunk of our team's resource and time to do. So Kim, could I ask you to share a little bit about that process, and then just let me know if you want to share slides or if you want me to move forward for you.
You can move forward. That'd be great. And just go ahead and click it all in. I forgot they were animated, or I would have taken it out. So as Johannes talked about today, we have the current experience and the way things are currently. We know that we have a goal, we have somewhere that we want to go, that we want to make things better. But I want to draw your attention to the bridge in the middle, and 2 core concepts around care pathways, which is really just families' experiences to and through the system, and then hopefully out at some point, as well as informing all of these processes with implementation science, because we know in any reform effort, transformation, installation of new innovation, that there's actually a better way to do it, and we have to attend to a few things along the way. So you can move forward that slide, Johanna. So again, just a reminder, not making it complicated. The care pathways are really just, how is it that families get to the system? Where do they first knock on the door, right? And then what happens? It's, they come through the door, and then what? And these are actual, again, quotes that were pulled from the Oregon Strategic Plan that families and young people shared about their experiences around help. How do you find it? How do you get it? Is it available? Who gets it? Those kinds of things. Johanna, you can click the next set in as well. And so in the middle, you see the youth and family pathway, and this is really an oversimplification, but thinking about and never forgetting, no matter the work that we're doing, that, if families say, whoa, something isn't right, we have a problem, where do we go to find help? When they find it, are they eligible for it? Can they gain access in a time, in an urgent way that matches the urgency of what's happening? And once they get it, was it helpful? And are things better on the other side? I think we can all agree that's what we want families, young people to experience. But when we think about implementation science, we know that we can't just attend to that middle row where all the colorful, arrows are. And that's what systems tend to do, is they really want to hang out there and figure out how to make all of this work. But what we're talking about with the SRSI indicators and the work with the locals are really that outer and inner context, which the inner context is that practice and community level. But the policy and management is where we're focusing, and that's the outer context. And we know for families and young people to have those experiences where they can find help when they need it, that their sense of urgency is matched, meaning there's no long wait lists, there's no, it's way across on the other side of the state, whatever it is, that urgency is matched and that help is actually helpful. The system has to do some things. And so what you see in those bubbles at the top are components of the system that we need to attend to at every step along that arrow for the young people and their families. And so again, it's that data that we want to analyze around what's currently happening. So that bridging slide, when we talk about the current experience to the desired experience, we want to know, what does this look like now? Because based on the information from what we've learned through the SRSI, plus the information that was in all of the documents that Johanna pointed out at the beginning of the presentation, that, maybe there's some opportunities here, to make things better. Nick, can you just go to the next slide, Johanna? So then if we think about the pathways to help being helpful, because we know that sometimes they're not, that consistent access and availability across the state is critical, key in, navigating. It's not going to be pretty necessarily. It might not be a straight line lined with tulips and, it's spring, tulips are coming, lined with tulips and beautiful trees, but we can define, what does all this look like? And so as we start to standardize the intake, assessment, eligibility, we need to be transparent in those processes and make sure that families know how to access the things that they need, and that access is equitable, that needs and resources are balanced, meaning they're matched. So there's not an expectation that, everything is just going to go away, but families reach out to systems because their needs and resources are not matched and they don't have access to the things that they need. And so we really want to design a system where families get what they need, when and where they need it. And that as a system that we're monitoring those care standards, not just for who gets in and who was served, but who is it that gets excluded? And that is really, really critical. And so when we take the administrative data for the state and we start to map this out, we can actually do this quantitatively. We can see who is it that's getting in and getting what, and what does their path look like? Like, is it squiggly like this road you see on the screen? Are there some linear pathways that might be a little easier to navigate? And then as we identify those are the levers we can start to push or pull depending on where we need to insert ourselves or move to start to change that experience for families so that they can get what they need, when and where they need it. So now I'm going to turn it back over to Johanna, unless you wanted me to say anything else, Johanna. I don't think so. I think we're good.
Yeah, thank you so much, Kim. I'm going to pause just a moment from slides because I was sort of desiring to see faces here for a moment and just pause a little bit on questions, right? Because the charge for our team to do care pathway analysis, which means we pull in our team of data evaluators who are, already sort of in action trying to get data use agreements in place with all of the necessary agencies in the state to start doing this policy. That is a charge for us to do from the SOCAC priorities. And for the rest of our time, we're going to pivot a little bit more about what our resources can do and how you would best like us to work and support local systems of care. And it feels to me like if we don't know what's going on over here on the left side, like how could we make good decisions about what to do on our right side? Kim, my working understanding of the care pathway analysis plan sort of to date is it's gonna take a minute, right? It takes a minute to.
Yeah, it's gonna take a minute.
Yeah. And by a minute, we mean like a long time. A minute in bureaucracy is months, right? Okay, so we're gonna, we're working to get agreements around data sharing and access. similar to work that the rest of us want to do around effective systems of care, perhaps. And then analysis and bringing our findings back to you all. So there's the reality that at some point in the near future, but not next month, the care pathway analysis information will be available for all of you that are doing system of care work. And there's also the reality that our work to support more effective system of care at the local level, like we have time to do stuff now that shouldn't wait for the care pathway analysis results, right? So it's sort of like it's coming, but that doesn't mean we should pause and not do anything else, if that makes sense. There are other ways that are not totally documented out on calendars for the system, the SOCAC priorities, their action steps to affect and touch local systems of care, right? So for example, in that data-driven decision-making, we see you operating and spending a lot of energy and resource on the barrier submission process. And that barrier process is a key set of data that's being used to drive system of care decisions. So we're going to be curious with you all on that. There may be some conversations about what's working and what could be improved in that process. That action will be driven from the SOCAC priorities and guiding of our work, right? And also touches the reality of local implementation. So I'm hopeful that those examples feel tangible in how understanding SOCAC priorities might help you all think about what you do with us moving forward. Are there any questions, concerns, considerations from any of the priorities you're hearing out of SOCAC right now that would be helpful to raise? And if it's like that was as clear as mud, you can tell us that too. And we'll like redo information and share it in a different way, right? We all learn differently and access information differently. And I'm super welcome to that feedback. Okay. All right, I'm gonna keep moving it then. We're gonna pivot, right, as I said, from SOCAC priority setting to what's going on in local systems of care. Okay, so for those of you that are doing work with Liz and I, you know where we are, but quick summary for everyone else. All of the systems of care locally that participated in SRSI got their data back and the results from the SRSI, and then we're all over the map in terms of, are we doing anything with it? So data getting back is one thing, but then prioritizing what's most important from these findings and what do we want to put into commitment and action plans. We have a couple of systems of care who have started those conversations and are on their first or second facilitated discussions around those. Almost everyone has given gut reaction. And then some of you are maybe waiting for today to find out what could next steps look like, right? So from the initial data report back, what's sort of that point in time reaction to what's important and urgent in these findings? The following themes are coming up across systems of care. I've worked with you for the last 6 or 8 months. I don't think there are any surprises here, other than maybe this hasn't all been put on one slide in front of you before. So we're hearing a lot of interest in figuring out how to make data-driven decisions. Some of you are interested in like, what data are we even talking about? What's available to us? What would we do to get more data? Like, who needs to be at the table? Some of you have done more of a mapping process and understand data that's available to you all and are sort of at that structural, like, ooh, how do we get better at sharing information across agencies? To my friends in rural, less populated areas, you're asking the questions of how do we look at service level data in a way that is de-identified, anonymous, and like safe, good data making practices if we have a really small population of children and youth we're serving. good questions. There's just a lot of interest around like, how do we get better at this? We're also hearing a lot of interest in, we know already without asking anyone, our care pathway, as Kim was just talking about, how children, youth, and families find us is not smooth. It's not perfect yet. But where is it most critical to make a change, right? Where are those interruption points that would sort of make the most robust change? So we're hearing questions around either could we document our care pathway, or we sort of know what that looks like. Could we spend some time figuring out the most critical interruption points? We have some interest in improving the barrier submission process. And particularly around communication, action. This is a robust process. We spend a lot of time using it. Can we make sure that it's as effective as it possibly could be? We are also seeing, in general, the barrier process being used to meet many areas of our work. And perhaps we've stretched the process to try to accomplish more than it can within the resources we have to dedicate to it. We're hearing a lot about improving bi-directional communication in two pathways between state system of care action and region system of care action. Lots of good improvements actually being named and pointed out in the last year and a half, and a lot of appetite to keep that up. Like, let's not let slip any of the positive improvements, and probably there could be some more. And then also, and this is directly back to the community level indicators that are scored in the pre-implementation of the SRSI. How do we as a system of care body locally communicate to our community and hear from our community? So a lot of interest in both of those communication pathways. Overall, I don't think I've been in a single community that hasn't said increasing meaningful youth and family engagement is important to us and needs to be on the table as a focus area. There's also a desire for increasing collaborative partnership across youth serving agencies. So really, I mean, I've watched you all tell me this story that, you know, system of care used to feel like providing wraparound services in behavioral health. And now we know that systems of care is creating this effective ecosystem of supports across systems for children and youth. And I think we're really jazzed about that idea. And then this critical component of like, we don't have everyone at the table that we need for all of this work. So I think this is mostly about, you know, a missing agency or a partner or sort of a community demographic that's missing. And a little bit like, is everyone at the table with buy-in, meaningfully committed to true collaborative work? The next interest is, this is around that indicator around the urgency of matching family need to time and service that's available. Mobile response service stabilization services rolling out of the state, yay. Also feeling very siloed from system of care work. So, you know, we've had a lot of discussion of like trying to get to the same table, thinking about how to increase collaboration there. And then the final theme that's emerging goes right back to the first priority we heard coming out of SOCAC is how do we become more effective at system of care governance? How do we take on the responsibilities and effectively implement the roles of oversight and accountability? So for those of you that have worked with me, this is not a prescription. This isn't like our recommendations of what to focus on yet. This is a labeled emerging themes because we're in progress in work with you. And also the consistency, like I just want to be clear that the consistency of these things coming up, no matter what side of the state we're working on, or if we're in a very populated or a very lowly populated community, you're all saying really similar things. And so just rolling up and the summary of this understanding definitely was a part of the flavor of why certain recommendations were made from our team to the SOCAC. I'll pause here, particularly if there are questions like, do these things make sense to you? Do you have, like, is something glaringly missing from this list? Is there something that doesn't feel super important on this list? Checking chat. Yeah, Amy, I think that's a really great question. And the regional health equity coalitions have not, I'm just scanning my memory, have not been, definitely not mentioned frequently. If they have been mentioned at all when we're talking about like who's collaborating locally. So maybe a question we should take back. So what I would love to see happen, right, is that these emerging themes move from emerging to a next iteration of sort of confirmed priorities. And how the heck would we make that happen? What happens next? So for those of you that are interested in continuing to engage with our team in ways that we have, so we're available as facilitators, we're available as resource example sharers. We're available to bring insight and learning opportunities. I'm pretty anxious to match some of you all together to have conversations with each other about what's working, etc. So working with us in the similar ways that you have, here are the things that we've committed to after the SOCAC sort of created their priorities. So this is clearly driven from a desire to move those 5 action strategies forward with the insight that we think because of the emerging themes on the last slide, there's going to be some value add desire for you all to participate in. This is what's on the menu, and we're really anxious to see how this lands and is helpful to you all. So one is an offering for shared learning. Having some sort of, a webinar, but hopefully less boring than all webinars, right? For our contract goes through June 30th, right? So for the next 3 months, engaging in collaborative learning around 3 of the action strategies we just talked about. So a learning session around collaboration, oversight, and accountability within system of care governance, a learning session on data-driven decision-making, and a learning session on using data to address disparities. So that would be shared learning. I think the idea would be there are questions we all have that could be answered more efficiently in shared learning spaces. For those of you that are creating action plans with us, you could then tie, and if your indicators connected back to any of these topics, some of your actions could be being in these learning sessions, right? And doing work afterwards. We are available for ongoing individual technical assistance or TA calls with local systems of care. There are a lot of you, and my calendar is like sort of open. So suggest available for sure for up to 3 calls, thinking about monthly with any of you that are interested in engaging. Those can be around just TA, like we have a thing we want to move forward. Can you help us do it? They can also, they're, sort of my vision would be they would be designed to help get you to action planning. Some of you are already planning these with us, right? And they can look like calls with Liz or myself and your system of care coordinators and your exec council that plans your agendas. We can just help you plan and support you in doing the work. Or they could look like us joining some of your work groups or committees and helping facilitate or guide through documenting strategies for action planning. Combination of their happy to meet the need you all have in your community. Some of the action steps that the SOCAC is interested in, they need to know what's working and what you all need and what's going well for you and what isn't. So some focus groups that we would facilitate with invitations out to the community. Spoiler alert, that might be how we talk about improving the barrier submission process. Our team is going to do the care pathway analysis that Kim just talked us through. That is going to be a big chunk of work with sort of findings coming at the end of the process. There will be work led by Kim and Denise to similar to the TA to local systems of care. There'll be TA to the SOCAC and primarily SOCAC subcommittees where work really gets done to move those 5 action plan strategies forward and to document and create an action plan to live, longer with the SOCAC. So these are this is sort of the menu for sure that folks feel really good about. And we hope that you can find ways that you might want to tap into something like this. And then we also definitely need your help in thinking about how we could make this work. Okay, good. So I'm, going forward in slides, meaning to go back. I'm going to pause here. Does anyone have questions about any of these TA resources or this plan? Do you want more details about what these things might look like before I ask you some questions?
Selby had a question in the chat.
Yeah, and I'm going to
Yep.
pull
Can
Kim
I-
in to answer.
I know, I was starting to chat back and I was like, ooh, I need to unmute and just talk this one through. So the way that this works is we aren't creating a new care pathway yet. We want to look at what does the care pathway look like right now. And so it's not a single pathway. It could be young people that come in through child welfare, juvenile justice, or they, I don't know, school referrals, whatever it is, how families first interact with this system, and then what is their pattern of utilization. And so that is what the current pathway in Oregon looks like, right? And that's what we want to map out, is what is currently happening. Then we take that information in partnership with all of these other conversations and say, okay, where do we want to move the lever or interrupt the current experience to create a new pathway or a new experience for families? That's when you start to get into the detail of what pathway are we focusing on? What does that look like? The data is going to kind of give us that information of where do we need to start. For example, let me put it in like other terms. For early childhood, for example, let's say, that the family is like, ooh, something's not right. I'm comparing my child maybe to my other children, people at school, friends, family, whatever it is, and I need help. I don't know what to do, but I need help. They reach out through their pediatrician's office. Maybe they get support, maybe they don't. But as the child ages, maybe, they're now in school, and now the school is saying, uh-oh, something's happening. Maybe there's an IEP that's getting created, whatever it is. Maybe there's some recommendations for community, community mental health care, whatever it might be, right? And so in the data that we're going to analyze, we can say, hey, this young person made it all the way to a residential setting or some sort of congregate care setting. But what we know about this family and this young person is they tried to get help for this young person way, way back. And so maybe that tells us if there's enough numbers or if it's, regionalized, maybe if that's happening in one part of the state more than another, is we can go and we can actually look at what happens when young people get identified or families are coming into care because they don't know what to do. How do we then make their experience one where their needs are met and they don't have to continue to get deeper and deeper into the system? And so that's the kind of work that we're talking about. And so it's not a single care pathway out the gate. Like our data analysis is going to look at everything right now. And then on the flip side, that's when you'll have an opportunity to create new pathways for families based on where we know that we could have intervened to really change the experience for young people and their families.
And then Selby, I would just add to that, we're also interested, depending upon what data we're able to capture, is to what extent does that family's experience differ depending upon race, ethnicity, location, where they live, which region, as well as which agency door they first knock on or first come into service. Both. Selby?
Oh, sorry. It's clarified for me now. I think when I was thinking of care pathway, I thought you have to like map the entire juvenile justice system, and then you're
Yes.
going to map the entire child welfare system, and then you're going to map education. And I thought there's like hundreds of pathways.
Yes.
Like we're
Yes.
focusing on reducing out of home placements. And I'm always
Yes.
telling my members the state data dashboard identifies over like 22 different kinds of out of home placement. So right there, that would be 22 pathways. What I understand from your explanation now is you're going to track it from the family. You're not tracking it from the system. You're going to track a family, and as such, you may you'll come across their pathway through weaving in and out of like whatever 3 or 4 plus systems. So I was understanding the initiation point of the pathway that you were tracking.
Yeah. And there could be potential, or opportunities, I guess, to look at system specific, because even within systems, it's not all the time, but most of the time there's something that happened in the past that got you to this point. And the key for solid systems of care is to be able to attend to both. So can we go back and can we change the experience? And do we know when needs are going to exceed that pathway we created? So now we are moving in intensity, right? And making sure that we're matching all of that up. So it does create a fun opportunity to think about. And there's sophisticated data analysis behind it, but that's not me. I'm not the one to talk to you. There's, things and statistical stuff. Those are my technical, very, academic terms for that.
Amy had her hand up and then down. I don't know, Amy, if you still have anything to contribute or ask.
Oh, when you were talking about the pathways and that, I was just wondering if any of it is looking at things like escalating to higher levels of care because of misdiagnosis. And so if you're looking at things like developmental disability, and especially in different populations, like early misdiagnosis for my child led to a hospitalization. Because of medical racism and ableism. So I don't know how you would capture that, but it leads to institutionalization.
I'm not exactly sure how that'll go. It depends on the elements of the data and the individual components that we can get. But if there's assessment data, we would be able to look, like, are there certain populations that are getting pushed into different systems, right? Or higher levels of care. And so we would be able to see that in the data if we have all of those elements, which I'm hoping. I don't know, Denise, if you were on that data call, if they're going to have any sort of assessment data or anything like that, or if that conversation even happened yet.
They're really trying to still determine which data sets we would have access to. But Amy, to your point, and maybe in addition to, we're also very interested in what services certain cohorts or classes meaning groups that the statistical analysis puts these care pathways into. Are there some groups that aren't receiving services? For example, in one state that we looked at, we saw that boys of color, young boys, ages 11, average age 11, were receiving medication only, primarily, as opposed to other youth. And then what was their trajectory as well? So it's what are you receiving as well as what are you not receiving? And does it vary according to that door and or race or demographics or all of the above?
As well as some treatments cause more trauma, like ABA.
Yes.
And early intervention can create more trauma when it comes to ABA and autistic children.
And so in the care pathway analysis, you would be able to see, like, what did people access, right? And so if there's, if it's statistically significant and those classes get created that show that this intervention led to this, or young people that participated in that intervention, right? That led to a certain pathway for them. That's a lever that can be shifted in the state. And that's what we're looking for, is where are those points when we can step in and change the experience for families. And as systems, we can create then new pathways when that emerges. So if a young person, for example, presented or was diagnosed with autism or whatever it might be, then we know, hey, this is the moment. This is the moment when here's the experience that we wish we had had before, but here's what it is now. And then you can track it as a system. You can know, like, did this work better? Did this stop the cycling through more intensive services or things that didn't work or escalating intensity of need? All of those things that can happen.
Brittany, it looks like you might have a question, and then I'm wondering if I can also just to share transparently, like Christy and Hillary, like I'm hearing a lot of synergy here, both around some of the data conversations that are happening separately, and also some of the findings in the Medicaid finance analysis. And I'm wondering if we can just commit to, like, keeping this as a discussion. So what Amy's raising here could come back to the data as we think about, is this a class that we could look at? It just feels like the dots are getting really close to each other. And then Jenny, was that your hand coming up?
Yeah, actually, I was just gonna say something about the data. It sounds like that is going to be a separate conversation. Is that what you were saying?
So there are places within, so the SOPAC action strategies, there are places like subcommittees that have been designed or picked to move steps forward. So there's a group of folks working on data use agreements so we can get to the start of the care pathway analysis. That work is moving forward. Is that helpful? Okay. So this is awesome. And one of my light goals for today was to pique people's interest in the care pathway analysis, because we've talked about it, I think, in very theoretical ways in some of our TA phone calls. And because it's actually going to happen, it feels like it's time to think about how it looks like in practice. I'm also going to just reshare my slides for the last slide that I have for you all, except I pulled up that report Amy shared instead of my slides. So let me just switch back here. Okay. The last sort of question, the last sort of piece of business that we have for you all is sort of around what's next. So really thinking about if we're dedicated to spending time supporting any interested local systems of care in taking your SRSI data results and turning them into action plans, as you think about doing that, and as you know that the statewide effort is moving forward, our two big questions for you are at the top of this slide. What could support alignment between state and local priorities? And what support or resources would you need to move forward priorities in your jurisdiction? So whatever region you're representing today. I forgot to do fancy animation on this slide. So you're also seeing my third very technical question, which is a request following a recommendation that came out of the group that plans your learning collaborative space. And that is, would you be willing or interested in making use of this monthly time for those collaborative learning sessions? I'm breaking a facilitator rule I have of asking you 3 questions at one time. That's not fair. I was just watching the clock. But we'd love to hear sort of immediate reactions to using this space for shared learning. Another option would be to schedule separate learning space, which we would do based on your feedback. And then are there ways that we could support alignment and moving your work forward? What might that look like and feel like for you? I'm gonna stop sharing because I like faces, and I'll put those questions in the chat boxes instead. Should have stayed talking about care pathways because it was way, way more fun to discuss.
Well, I'll throw some ideas out there off the top of my head. So you have something. In terms of what could support alignment between state and local priorities, I'm thinking that it needs to be more than just the coordinators here from SOCAC and try to take it to their local groups when the local groups already are busy or trying new things. And so I'm really wondering kind of how to expand the connection between SOCAC and local systems of care, whether that's like SOCAC staffer magically find time where they could, and we magically find time, but like, could we have a meeting of 10 or 12 people, or you're meeting with the regional leadership structures of each, like the co-chairs group, so to speak, of each of the local structures, something like that, but to have it be more than just this tiny little communication from SOCAC to the coordinators, because I know we try to pick up and bring things forward, but then the question becomes engaging our councils around that alignment. And that's where it might be helpful to have increased contact in terms of, like I said, coming to regional, like I have a regional leadership meeting once a month, for example, where just the chairs of the committees are around the same table to look at governance across the board. So like that might be an opportunity to hear from SOCAC staff. And then in terms of resources to move priorities forward, I mean, the obvious one is always money. And if it's not money, it would be help to develop that collaborative funding structure locally. Like I have some ideas I'm pursuing around getting on everybody's budget cycle yearly, right? But it's like 40 organizations are a lot of budget cycles for me to try and be engaged with and supplying them what they need. And we're looking at grants and all these different things. But, this idea of collaborative funding and getting, again, local system leadership to fully embrace that, like that's a whole project in and of itself. So again, if SOCAC can't directly give money, how could support be built in to really engage in some kind of meaningful collaborative funding effort?
Thank you, Selby. So definitely hearing that sort of bi-directional communication piece, and some of that is like, how do we bring state leadership to local community and not rely singularly on system of care coordinators, and then funding, and you've got some support coming into the chat around that. I like the idea of thinking about it in two ways. One is like, when we need funding, we need to ask for it, right? So like, just say that. And the second is that this is not just a tri-county, this has come up in many local systems of care. We ask on the indicators about like financing and like, how are you funding the work that you're doing? And the very real challenges of budget cycles just being different across county agencies is a very real tangible challenge. So are there ways to help make those asks locally? Great. Pamela, were you gonna hop in?
I apologize. I'm not used to this app, and I don't know how to raise my hand on it, so I apologize. I just wanted to interject real quick here. Coos and Curry County both have had the privilege and the honor to have Hillary join us at previous meetings, and also Anna has been very flexible in joining us with one of our primary barriers that was, and also providing us updates firsthand, which I don't always get correct. So it's really nice to have firsthand information from the people who are doing it. And I know that our committees are very appreciative of you joining us at the local level, and it's very impactful, and I would really advocate to any of you to do that. Now you're going to get flooded, but there but it's been my experience that when I reach out and ask for any support locally, that I've been met with a great response.
Thanks, Pamela. I think Anna smiled. I'm not sure.
I just want to say we love being asked to help out. Carol's here to help out. Hannah and Christy are, I am. You know, if you've got questions, please don't sit on them. Ask us. Christiana's now on board, and she's such a great resource with all her system of care and wraparound perspective. So please use us, as well as these folks from UConn.
Yeah, and just to add, I think around some of the data-driven data analysis priorities, like the timing couldn't be better because y'all, we are actually getting a dedicated research and analyst to the system of care. Like second interviews are scheduled in April. So assuming it all goes well, we'll actually have like a person fully dedicated to answer and help you and walk alongside you in all of your data analysis dreams. So super exciting.
Just uplifting a new comment, Lucy, I'm hearing this in the chat, and then if you want to come off mic or just correct me in the chat, but this idea that there are workforce challenges and shortages, so like hard stop, I think we all agree, but specifically naming that then becomes a challenge in, I think what you're saying, Lucy, is to get people even to engage in the system of care committee structure, that has become the challenge.
Yeah, we've definitely seen shifts, over the years. And in the last year, especially, I mean, it's so hard. There's so much staff change at organizations. There's been a lot of retirements. And so a lot of the, sort of institutional knowledge around different SOC systems has disappeared. People have, one of the things about Zoom is that people are just squished between meetings, and it just feels like, we've had to struggle more and do more work to sort of personalize what we're doing with the SOC and make it relevant to actually get folks to come and to engage, and it's not consistent. So we can't rely on some of our system partners to really make it. I think we've really seen that with juvenile justice, really lost a lot of our juvenile justice connections. And I think, there's just a lot of pressures, and we're coming in with a lot of good ideas and sort of offering a lot of help, but then we get these barriers that are like, they're so huge. They're like, let's create world peace. I'm floored, and I just think families and youth have a lot of needs, and the system's not working for them. And I think they come to us with sort of a lot of hopefulness, and then I just feel so frustrated because there's very little that we can do on those big barriers. On small barriers, we've been pretty successvel, but on really big barriers, we can make some recommendations or send some, advisory letters and listen. We're happy to listen, but I don't know. I think one thing that I would suggest is that because system of care is very focused on behavioral health, my recommendation is that we really try to focus on what we can accomplish and make sure that more than anything, we are focusing on the complex behavioral health needs of youth and that, the needs that families have for their help with youth. And I think it just feels like we've got so much on our plates. Maybe we don't even get to those most critical sort of primary things. Mm-hmm. So there's a lot of stressors on the SOCs for sure.
Thanks for adding more to your comments, Lucy, in the chat. And so I come from youth engagement work, and so I know when I go into a meeting that we will decide to change the world. That will be the desired outcome of every meeting. And also then it becomes my job to be like, okay, but can we pick one thing that we can make better tomorrow, right? So just really resonate with that. And so one of the things I'm thinking about is when we showed you all the recommendations to SOCAC, there were those grayed out boxes, and you all just like picked things out of the grayed out boxes. So just this idea, right, of like, if we had a deeper, more robust understanding of effective systems of care within our state level system agency partner folks, right, it could be easier to, that like messages could come down. That would be helpful. Like it's hard to convince a juvenile justice system that's overwhelmed and has workforce shortages to show up to yet another monthly meeting if there's not also sort of a coordinated pressure and understanding coming down of why this is important and why this is actually their space. And I don't know that this is a solution, but I'm wondering if we could practice in to sort of what Lucy's saying and what Selby's saying in these ideas of hosting some focus groups that might not be just system of care coordinators and just SOCAC staff, but could also be some of your key regional leadership engaged in, like, how do we make a barrier process better? Like, how could we make data-driven decision makings? What does that actually look like? If we could practice some of those communication spaces and then leave that as sort of a muscle to continue to work and for many months to come. Very aware of time and of the beautiful comments that keep coming into the chat. Are there any, just in terms of wanting to honor the space that you have and then maybe asking you to join us in new space, any feedback about whether we offered learning collaborative sessions starting in April at this monthly time versus scheduling a different time? That feedback would just help us logistically make sure that we move forward, work with you all, and either use this time that you all have or respectfully get out of your way and use a different time. Thanks, Julie.
And we should appreciate that 6 o'clock is your time, and so you would really love it to be a little earlier, really, wouldn't you?
I'm the one who loves flexibility in my job, so I don't need that specifically. I think, I think Payne, maybe, I don't know if you meant this, Selby, in this way or not, but I'm going to use it as this. I'm wondering if the people that you all need to hear messages about what do system of care effective governance structures look like, how do you make data-driven decision making, are those people in this room, or would you really like to invite other people from your system of care work into that space? If we created a new space, would that invitation be easier for you all?
And I'm going to say maybe yes, just having seen that over the years, it just creates a different buzz to create a different space. That's my take on it from experience, but.
And we have heard the question. I'm sorry, Hillary, I don't want to talk over you.
Selby has a
an
opinion.
I was just gonna say, I don't know if it's the time. It's so much like the actual time slot. Like, I mean, it's just, right. It's getting people to come to extra things. And I think our committee culture is changing, but I think in a lot of our committees, there's this viewpoint that the coordinator does it, or the coordinator somehow brings the skill or expertise and tells the structure what to do. Like, I think if I was going to bring in like some of my executive leadership council to some of these meetings, like that will require me doing like one-on-one reach out, as Carol knows, like we're planning a special training later this month, and I have to send out messages about please prioritize this training. Like, I'm really asking you to come to this new thing that's different than a regular meeting. So I don't know if the time slot's so important. It's just the work of the coordinator to get those additional members to be invested enough to come to an extra meeting.
I can lend you my magic wand.
Hillary, I didn't know you had a wand. You've been holding out on us.
Uh-huh.
All right, I got dibs when she's done.
Hey, I was gonna say that, so we're gonna have to fight over it, Grace.
All right, Jenny, you're on.
Okay, so I'm hearing that it is valuable to have other system of care leaders engage in learning space. It is a significant responsibility and effort to invite them to any space, no matter the time and date. So I think that I might lean towards, it might come back just to the planning group for this meeting on if there are other timely topics that need to be addressed over the next 3 months. And if there are, we would leave the space for you all to do your work. And if there aren't sort of agenda items that need to be addressed in this learning collaborative space, it doesn't sound like an awful idea for us to use that space. Okay, yeah, Denise.
And I think I'm also hearing that we would work with the planning group to ensure, do our best to be all-inclusive and get as much participation from state and local partners as well. So strategies on how to do that, whether we use this space or another one.
Oh, I like that a lot, Denise. Right. Yes. So also thinking about like our SOCAC leadership and how they could engage in this space. Yeah, let's not miss that. Okay. I know we're at time. Thank you all very much. I'm hoping that in some of slides and information sort of made sense or wrapped up stories of experiences that you've all been having with us over the last few months. My intention is to connect with system of care coordinators via email just around that next TA plan step, so you feel like you have a very clear way to say, yes, we're interested in engaging. Feel free to reach out to me, right now if you want to as well. That's just fine. We'll plan to meet you and invite you into some sort of shared learning space again next month, and are really excited to keep working with you all. Thank you for what you're doing to help children, youth, and families every single day in Oregon. We're really glad to be your partners, and we'll talk soon.
Thank you. Have a good
Thank
rest
you.
of your night.
Thank you.
Bye, everybody.